I'm Jeffrey Heftler. I'm one of the interventional physiatrists. This is a little bit out of my wheelhouse normally because I don't treat chronic pain, but I get questions about medical marijuana a lot. So I don't prescribe it, but I do think it's better to be informed. So I'm going to give you a lecture about its role in treating pain. It's always good in the morning when you're looking through your lecture and rehashing it to realize that you have a spell check in your first slide, which I do because the word roll is spelled wrong, but hopefully the rest of it will go well. So there are two different classifications that I'm going to stick to, CBD and marijuana, because they're both sort of hot topics right now. CBD is an oil made from the plant. There's a lot of benefits. If you look at the list on this ad, how many benefits there are. It's all over the place. There are stores all over dedicated for CBD oil. So it's a really question that patients will bring up to me often. It's a phytocannabinoid, which is just sort of part of the plant. There are 113 of them in there. And it accounts for 40% of the extract. So if you do break down the plant into extract, most of it, or a good portion of it, is actually the CBD oil. It does not contain THC. So that's one of the things we're trying to avoid. It's one of the benefits of it. It can either be inhaled, smoked or vapor, aerosolized into your cheek, or by mouth in a tincture. Because it does not have THC, it doesn't cause any mood alteration, which is good because that's what we're trying to avoid. And the WHO said there's no effects indicative of any abuse or dependence potential. Again, when we start to classify things as to safe, that's what we're looking for in terms of pain management. THC attaches to a CB1 receptor, which affects all of the other things, in terms of mood and thinking and coordination and appetite. CBD attaches to the CB2 receptor, which is pain and inflammation. Again, low risk, good targeting, things we're looking for. And it also helps to make your body's own natural cannabinoids. Can make you tired, can give you diarrhea, change in appetite or weight, but those are pretty low side effects in terms of the frequency of those. It is legal in all states. There are some restrictions, and those restrictions are if it's made from a marijuana plant, it's restricted. If it's made from hemp, it's not. So the majority of the ones we're going to find are made from the hemp plant. Its best evidence is treating childhood epilepsy, which again, when you're looking for safe things that are advocated for kids tends to make it safe. It can interfere with their meds, but since we're not giving it for epilepsy, that's less of a concern. There's a study from Europe that showed it decreased pain response in animals from arthritis and inflammation. And there's another study that shows that it decreases an inflammatory marker, TNF alpha. So that's one of the things that we use to try to decrease, one of the areas we're trying to decrease in terms of pain and inflammation. There's one study that showed, and it is advocated for PTSD, that in an animal model, if you gave it immediately following a stressful event, it can limit the generalized fear response. It's got to be immediately following it. So unless we're going to advocate everyone carries a bottle with them, and in a stressful event, you're going to take it as the first thing you do in your stressful event, it's probably not going to be used for that. It's effective in treating pain from MS, and that's where its best evidence comes from. And there are long-term studies looking for it being treated versus opioids, but they're still not out yet. The biggest issue is it is a supplement, and all of the same rules with every supplement apply, which is we don't know what's in the bottle. If you go to any sort of GNC, you're gonna not necessarily know what you're getting. 40% is under-labeled, which is higher than reported dose. 35% is over-labeled, which means 75% of them are not what you're getting on the bottle. And you don't know what's in it, so you have to get from a reputable lab. And we don't know the right dose. So it's safe, right? We know it's safe. You just need to make sure you know what you're getting with it. And we need more studies. But I think when patients say to you, hey, this is helpful, I say, great, keep taking it, it helps you out. Marijuana plant, right? That's the bigger question that everyone sort of brings up. It's the dried flower of the cannabis sativa. It can be smoked, vaped, or edible, but it does contain the psychoactive THC. But there's also 100 other cannabinoids that are in there. So it's not just the THC. There's other stuff that may be additive that marijuana has that the CBD oil does not. It is legal for medical use in 42 states, including New York and Connecticut. So it can be used to treat pain, nausea, appetite loss, Parkinson's, inflammatory bowel disease, PTSD, epilepsy, and MS. So a lot of variation in things it can treat. It is still not legal from a federal government standpoint. So if you're going to take it on an airplane, you're going to be in trouble, and there are certain states that you can't take it to. So just within a state, it may be okay, but just careful with patients traveling. JAMA did a review article back in 2015, and they looked at 28 randomized studies, and they found that it could be helpful, especially for neuropathic pain due to MS. This seems to keep coming back that MS and pain with MS seem to be great indicators. The other studies are not as well defined, but the MS ones were supported with high quality evidence. There's another study from Canada where they reviewed 6 studies, 5 of them had high quality. There was difficulty in masking, which means people knew what they were taking, right, because they got the other side effects. And short duration use, 5 days, but there was some pain relief with low dose. So some evidence that it may be helpful. Medicare ran a study that showed that in states that had medical marijuana, that there was less opioid use. And then there was a follow-up study that showed that wasn't necessarily the case. So that's out there. If you hear about that being out there, they did sort of review, and that seemed to not be the case. And the NIH then looked at a 2018 study for chronic pain. They did 47 studies, showed a small benefit. There was another review, which was a specific brand model, brand of it, and shockingly, they said their brand was great, but it's biased, right? Because any study that's sponsored by a company is probably biased. And again, when they looked at the medical marijuana laws with non-medical prescription opioid use, that turned out to not be associated with a change in that. So not necessarily going to help with non-medical opioid use. It does have some abuse potential, no shock, right? So we knew that. The biggest concern, especially the younger people, is affecting brain development. So this goes across alcohol, marijuana, right? 18-year-old kids, probably for boys, 25-year-olds, right? You got to be careful with advocating for that. Every issue with smoking exists, right? So smoking tobacco and smoking marijuana have the same problems. So just being aware of that. Not for use in pregnancy. And again, some level of addiction potential. There's a 30% marijuana use disorder. It's 4 to 7 times more likely if you started before 18. So just being aware it's not without its risks. There's not great evidence out there that it is helpful in chronic pain. However, with the opioid epidemic that we're dealing with, it seems like it's a reasonable alternative, but we can't prove that yet. But I do think that it's a reasonable option. It may be treating their anxiety more than their pain, but that's a part of chronic pain. So the downside of treating someone's anxiety is low, especially if they're using opioids to treat that. No good large scale or long-term studies, so we need to keep working on that. And lack of recognition by the federal government. So these are the things. So the answer is we don't know, but there seems to be some benefit. CBD definitely safer and less side effects. Hopefully in the next couple of years we'll get some better evidence. Thank you.